Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. Today is our 5th anniversary, 5 years and going strong. Tonight's program is the Zika virus. Find out about it right now. My guest this evening is Dr. Monique Duwell of the Center for Disease Control, now deployed with the Maryland State Department of Health. Dr. Duwell, welcome to Housecall.
Thank you so much for having me.
Our pleasure. So briefly tell our viewers about your professional background.
Sure. I went to medical school at the University of Pennsylvania. I did my residency at George Washington here in Washington, D.C. And I did my public health master's degree at Johns Hopkins. And I'm delighted now to be doing the Epidemic Intelligence Service Fellowship with the Centers for Disease Control, or CDC. And as you mentioned, I am currently assigned to the Maryland Department of Health, and I work in the Infectious Disease Epidemiology and Outbreak Response Bureau there.
Very impressive background, and thank you for your service to the community.
My pleasure.
So the topic for tonight, as you know, is the Zika virus. Explain to our viewers what exactly is the Zika virus.
So Zika virus disease is caused by the Zika virus, and this is a virus that is transmitted to people primarily from the bite of an infected mosquito. In many people, it will cause no symptoms or mild symptoms, but unfortunately, we know that Zika virus in pregnant women can cause very profound and serious birth defects, which is why it's a disease of such great concern.
Sure. And let's take 2 examples now. An adult who does get symptoms, and the other would be a pregnant woman where the baby, unfortunately, the infection is transmitted, the different manifestations in a baby. So let's first take a healthy adult. What can happen if it's not mild viral syndrome, but rather they get sick? What kind of symptoms develop in a healthy adult?
Sure. So again, a healthy adult may have no symptoms. The mild symptoms that we might see with Zika virus would be fever, headache, rash. People infected with Zika virus can also get red eyes called conjunctivitis, muscle aches, joint aches. Very rarely, Zika virus is associated with something called Guillain-Barré syndrome. That's a neurologic syndrome. It can cause weakness in the arms and legs. Rarely, it can progress to cause problems with the breathing muscles as well and be life-threatening. But again, that particular manifestation is quite rare, thankfully, among adults.
So let's shift gears then. A woman is pregnant, unfortunately is infected by the Zika virus. What potentially can happen to the baby upon delivery?
So the potential risks to an infant born to a mother who's been infected with Zika virus would be, our first concern would be what's called microcephaly. Microcephaly is the term for a smaller than expected or normal head size for an infant. And unfortunately, that is often associated with cognitive deficits. There's a host of other birth defects that might be of concern as well. So while that doesn't always happen, it can happen in the case where a woman who's infected with Zika virus during pregnancy.
And with a smaller head and cognitive defects, you're also implying that the brain development is adversely affected.
That's exactly right. And we don't yet still know the kind of longer-term, lifelong manifestations of that, but it is being followed closely.
Is this a new virus? I mean, we didn't hear about Zika until just a few years ago.
So it's not new. Zika virus, I believe, was discovered in the 1940s or 1950s originally. But fortunately, didn't cause significant human infections or epidemics. There were localized outbreaks seen in different parts of the world, but really didn't come to international attention and concern until around 2015, when the most recent epidemic was noted. And so that has unfortunately become a worldwide problem.
Now, you do mention worldwide, and yet there is certain geographic areas that have a much higher risk. Of course, much of the news came out of Brazil 3 years ago. So explain to our viewers what are the most common areas that are at risk for Zika virus.
So the areas that we're primarily concerned about would be South America, as you mentioned, Central America, and the Caribbean. However, Zika virus is also present in North America, Africa, Asia, the Pacific Islands, so it truly is a worldwide problem.
And is that because the infected mosquitoes are hopping on ships and planes, and how are they getting distributed throughout the globe?
Well, one contributing factor is certainly human travel, and we know that certainly now, more than 50 years ago, people are traveling internationally, and so that's certainly a contributing factor.
And how common of a risk is it if somebody has Zika and they had a mild infection with no significant symptoms, or they felt they just had a mild flu bug and they kind of shake it off? What is the risk, for example, of transmitting it through sexual contact?
So it's certainly, sexual transmission of Zika virus is certainly a risk. So we know that Zika virus can persist in the semen in men, and this is certainly the most concern when couples are considering conceiving. And we want to take extra precautions for people who are in the scenario where they're considering becoming pregnant.
Sure. And my understanding is mentioning the male risk persisting, it's up to 6 months. Is that correct?
That's exactly right. Yeah. And so we recommend that men who travel to areas or that have risk for Zika either use condoms or abstain from sex with a partner that's considering pregnancy for 6 months. For a woman traveling in a similar scenario, that's actually only 2 months that we recommend.
Okay. And you mentioned all these areas that were the first locations for Zika virus. And now, of course, it seems to be creeping northward. I mean, the question a few years ago would have been, what are you doing in Maryland? You know? So what are you doing in Maryland? Is Zika a concern in Maryland?
Well, the good news is that there's been no local mosquito-borne transmission documented in Maryland. So what that means is no cases that we're aware of where a mosquito carrying the Zika virus has bitten and infected someone in Maryland. That being said, there are particular types of mosquitoes which are capable of transmitting Zika virus. Those species are called the Aedes aegypti and the Aedes albopictus mosquito. And those mosquitoes are present in Maryland and many states throughout the U.S. And so even though we've recently seen a decline in Zika infections worldwide and among Maryland residents, the fact that those mosquitoes exist here still, I think, emphasizes the importance of taking preventive measures here in Maryland.
Has there been any dialogue between the CDC and the Environmental Protection Agency, the EPA, about any of the conjecturing that some of the northward spread of Zika virus from South America up to North America may be related to climate change?
Well, I'm not sure of any of those particular discussions, but we certainly do track kind of where particular mosquitoes are, and we know that mosquito populations are changing over time. Climate is changing over time, and it's a very dynamic situation. The paths that people travel are changing over time, and so there's so many different factors, and that's really why not only CDC, but local and state health departments are tracking Zika infections very carefully and really want to maintain vigilance about the disease, even though we're seeing declining numbers.
All right. So let's discuss prevention, and we'll discuss it in a global way and then a personal way. And I'll give you an example. One of my adult daughters, she's married and has a beautiful grandchild for us now living in Fort Lauderdale. And when Miami, Dade County, had a big panic about Zika virus last year, they had massive spraying. How effective is that kind of preventative measure for a community to have an entire community, all of Dade County, including all these resort areas, sprayed?
Well, I think experts in mosquito control, I think, would emphasize the importance of kind of multiple different strategies to control mosquito populations. And so kind of the more wide-scale spraying, targeted spraying to particular areas are part of that strategy, but really also emphasizing what we call kind of personal protective behaviors as well is also a real key component. And so educating people about ways to protect themselves from mosquitoes, I think, is a tremendously important part of that kind of overall strategy.
So do you think somebody, if they're concerned in an area that's being sprayed, should also wear special protective clothing?
I do. I think that I think there's a few simple steps that can have a big impact on protecting someone from mosquito bites. And so, though this isn't quite as much fun during warmer weather, certainly wearing clothes like long sleeve clothes, pants rather than shorts, kind of covering up those areas of skin can certainly protect someone from mosquito bites. I think carefully choosing and using insect repellents is another important strategy. So there are a lot of different insect repellents. CDC recommends insect repellents that are EPA registered. There are different active ingredients that it's important to look for. One of those is DEET, which is probably the most well-known to people. The CDC website has a kind of a list of other active ingredients that you want to look for and make sure that you're matching up your insect repellent. So I think that that's another important part of protecting yourself.
And certainly, to amplify on your point, it's difficult during warm weather. You can imagine what it was like for my daughter, son-in-law, and granddaughter in the heat to have to wear extra protective clothing, plus have to smell the defumigation.
I can only imagine.
You know, they would watch the helicopters flying overhead.
I can only imagine, and I think that you know, need to kind of weigh a lot of different risks and benefits in these scenarios, but when we think about the potential severe consequences of Zika virus and the birth defects that can be associated with it, I think that tips the scales a little bit in terms of kind of these, you know, more intensive, comprehensive approaches. So,
we have 1 minute before we go to the break. Viewers are going to wonder, well, wait a minute, if this is an infection, why can't you give an antibiotic and cure it? What do you say, Doc?
Well, unfortunately, there is no particular medicine we can give to cure Zika virus. The things that we recommend in cases of people who are infected with Zika virus are somewhat simple typically. Fluids, rest. If you have a fever, taking acetaminophen as a fever-reducing medicine. One important point I do want to mention is that Zika virus, the symptoms of it can be confused with dengue fever. And
another tropical disease,
which is commonly found in the same areas as Zika. And so we ask that people avoid medicines like aspirin or NSAID medicines because these can increase the risk of bleeding. This is a concern if you have dengue. So we want to make sure people have dengue ruled out after they see their physician or other healthcare provider before taking those sorts of medicines.
Very good. We're going to pause briefly for a public service announcement. More with Dr. Monique Duwell discussing Zika virus. We'll be right back.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay. Just go to the site.
We're back. My guest this evening is Dr. Monique Duwell of the Center for Disease Control and the Maryland Department of Health. And we're discussing the Zika virus. Dr. Duwell, when we paused for the break, we were discussing treatment of adults with Zika virus, and you said it was really only supportive care. What about an infant who is, upon birth, diagnosed with Zika virus? They have microcephaly, the brain developmental issues, etc. What can be done there?
So for infants diagnosed with Zika virus infection who may have abnormalities that are visible or evident at birth, it's very important that those infants are followed very closely by their health provider, whether that be a pediatrician, family doctor. There are some specific guidelines regarding the type of screening that they need related to vision and hearing, in addition to the normal developmental screenings that are recommended for infants. And so that close follow-up of those infants and tracking over time is very important, so that if and when delays in development are noted, that those infants can get additional support and services to support them. And fortunately, Maryland has kind of a wealth of services available for those infants. And so the earlier we know about any sort of developmental cognitive issue in infants or young children, the better we can intervene on those and help them.
So are you aware of any CDC or FDA or World Health Organization clinical trials looking at potential medicines to treat the Zika virus?
So I'm not familiar, and I don't work directly with clinical trials. However, I do know that the CDC, as well as state and local health departments here in the United States, do carefully track people, including adults and infants that are diagnosed with Zika virus, so that we can better understand the changes over time that can occur when people are infected with the virus.
Now, there has been some reports that I've read that there may be differences in how Zika virus, in terms of its severity, may present, for example, in Brazil versus other parts of the globe. Are you aware of any such reports?
So I'm not particularly familiar with that literature, but it certainly seems possible that there are variations in the manifestations, the complications related to the disease, and those might be differences in populations of people, might be differences in mosquitoes, might be differences in environmental factors, treatments, interventions. So I could certainly see how a host of different factors could contribute to different presentations of the virus.
Given that some of the Zika babies born, for example, in Brazil, when there was the first epidemic reported a few years ago, if they survived and now several years old, have there been any studies that looked at how those children are doing? Or did they have cognitive catch-up, or were they kind of left at a difficult cognitive phase?
So my understanding is that there's a lot of variability, and I think it still remains to be seen. Actually, not that much time has passed since the epidemic started, and so I think it'll take careful tracking over time to really get a full understanding of how this virus will impact those children and their families.
So let's focus now on the state of Maryland, because many of our viewers may have practical questions about themselves. And we'll take different examples. You have a young couple, they have no children, and they're thinking, wouldn't it be great to go down to Rio de Janeiro to enjoy Carnival? What would you say to them about the advisability of going to Brazil?
Well, I would say for anyone considering travel, and did you say that this couple was considering getting pregnant? They're
considering eventually having a child.
Okay, great. So I would recommend that they first go to the CDC website, the Zika website, and there's a specific section related to travel. And so that website is www.cdc.gov/Zika/GEO. And that will take you to a world map where you can type in the destination that you're considering traveling to. And then you'll get a really nice pop-up box that outlines the risk of Zika virus infection in that particular area and the CDC recommendations for travel. And I should also mention that I think it's very important, particularly in the scenario, that you outline that people involve their healthcare provider. in these discussions as well. And so we certainly recommend that if a woman was already pregnant or not using birth control and was sexually active, avoiding those areas with risk of Zika would be very important because of the potential for birth defects that we discussed. And certainly anyone who travels to an area with risk of Zika, if someone is not pregnant, we want to really emphasize the importance of taking protective measures to prevent mosquito bites as much as possible. I think one important point is also the partners of women who are pregnant or who would like to become pregnant. So as we mentioned, Zika is can be sexually transmitted. And so recommendations are for, in the case of this couple, if they did decide to go to Brazil, we would recommend that they wait at least 6 months before attempting to conceive after they return from travel. Or if they return from travel, developed symptoms of Zika virus 6 months from when those symptoms started.
What about blood transfusions? Are there any reports of transfusion-related Zika virus infections? So
I believe there is evidence that Zika can spread through blood transfusions as well, but I'm not familiar with the specific numbers related to that. But the primary modes of spread would certainly be mosquito bites from a pregnant woman to her fetus or sexually transmitted.
Is it reasonable that if a woman's considering getting pregnant, simply not to go to any of these high-risk areas? Savannah Guthrie, a reporter for NBC, famously announced that she was not going to Brazil during the Olympics because she was pregnant.
So certainly if someone knows that they're pregnant, I would definitely recommend not going to those areas. I think that's where involving your healthcare provider in those discussions becomes important, particularly when when it's not quite so straightforward. If someone is not pregnant, they're considering getting pregnant, kind of all the ins and outs of those discussions, I think a healthcare provider can be very helpful with. And certainly waiting the 6 months after travel for a couple is important. If someone, and certainly during that time period, if someone is sexually active, to use the most effective birth control method possible to prevent pregnancy during that time period until after the 6 months is up.
Well, some of our viewers are going to wonder, are you implying that oral contraceptives or an IUD would be okay, or would it be better for the male to be using a condom during that time period to totally prevent infection?
Well, I think
it's not just sorry to interrupt, but
please.
It's not just a matter of preventing pregnancy, but also preventing transmission of infection.
Absolutely, and I think that's a great point. So I think condoms are going to be a very effective way of reducing the risk of transmitting Zika virus. Certainly abstaining from sex is the 100% way, but yes, you make a good point.
If somebody feels fine, they have an exciting trip to any of these tropical areas, they come back, and now they're considering getting pregnant. Should they be tested first for Zika? And if it comes back normal, it's okay to try to conceive and have a child? Or do you still wait 6 months? So
preconception testing is not recommended. So it's really recommended to wait that 6 months to be safest.
Let's go on to other scenarios here. A woman is pregnant and has a healthy baby, but was not pre-tested for Zika. And now delivers. Do you recommend Zika testing in that scenario?
So in the case of, would this be in the case of a woman who has traveled to an area? Yeah. So in that case, no, we don't recommend testing in the case where there's no abnormalities in the infant, where the mother hasn't been diagnosed with Zika virus, so no testing wouldn't be recommended in that scenario.
So routine Zika screening for a woman who's pregnant who's been to South America is not necessarily required?
No, and there's a lot of kind of complexities to the recommendations related to Zika testing. So the Maryland Department of Health has some very kind of a very specific table of guidelines related to different scenarios. And so I can kind of briefly walk through some of those that might be of interest to viewers. So certainly anyone who has symptoms of Zika virus after potential exposure to Zika virus, we do recommend testing. Pregnant women, and certainly if they have symptoms, we recommend testing. And then for pregnant women who don't have symptoms, who are asymptomatic, that's where things get a little bit more complex. And so women who have a one-time exposure and who are pregnant but asymptomatic, testing is not necessarily recommended, but that is a discussion between a patient and provider that I think should be had and a mutual decision reached. And then the case where a woman is pregnant, doesn't have symptoms, and has an ongoing risk of exposure. So that might be ongoing unprotected sex with a partner who recently traveled, a woman who might be traveling back and forth from or to an area that has a risk of Zika. So in those cases, we do recommend testing for those women. So there's a lot of subtlety based on whether you're pregnant or not, which symptoms you have, when you've had the symptoms, where you've traveled, what your ongoing risks are. And so it is often a more detailed discussion between a patient and their healthcare provider to whether or not to pursue testing.
Well, many of my colleagues that do obstetrics, they're also wondering, with all these different subcategories, how to approach when a patient asks these questions. I'll give you another example. Many patients who are pregnant wonder, well, is my time period of risk for Zika first, second, or third trimesters, or is it the entire pregnancy? What would you say to them?
Well, I would say that we want to be careful throughout the pregnancy. And it's certainly something to discuss more with your obstetric provider. But I would just really re-emphasize that the importance of avoiding travel to areas at risk for Zika virus infection throughout the pregnancy, and as well as having conversations with a sexual partner regarding their travel, their potential exposure, using condoms if possible, if there is that type of exposure.
Sure. What about placenta testing? Where does that come in?
So placenta testing for Zika virus can be performed or should be performed in certain scenarios. Certainly if an infant is born with symptoms that are consistent with Zika virus, and we know that there is a potential that the mother could have been exposed with Zika virus, that testing should certainly be done. If a mother was diagnosed with Zika virus during pregnancy as well, we would want that testing to be done. If there's a healthy baby with no signs of Zika virus, where the mother doesn't have lab evidence of Zika virus, then we wouldn't recommend pursuing testing right now.
What effect has the change of seasons had in the different epidemic areas? So for example, when South America went through its winter and things cooled off a bit, was there a drop-off in the number of cases?
Well, I think the bigger, I think there is certainly seasonal variations in different parts of the world. The bigger trend is certainly that 2017 there was an overall pretty stark decrease in number of cases from 2016. And one of the primary contributing factors to that might be as people develop immunity to the virus, we see that type of decline. But given that we know the virus still exists, we know that the mosquitoes that can transmit it exist in Maryland as well as other states, I think still being vigilant, still helping to make sure people are aware of the risk is very important.
Since this is a virus, has there been any attempt by the CDC to develop a vaccine to prevent the infection?
So I believe there has been scientific work into developing Zika vaccine. There is no approved vaccine for Zika, and so right now, and so I hope there is one in the future. But for now, we really need to focus on those efforts that we discussed, being protecting yourself from mosquito bites, reducing your risk of sexual transmissions, and pregnant women avoiding exposure.
Dr. Duwell, thank you for joining us on Housecall.
My pleasure. Thank you for having me.
My thanks to Dr. Monique Duwell for an excellent interview on the Zika virus. My thanks to my terrific team here at the station. We're 5 years and going strong. And most important, thanks to you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's very appropriate given what we've covered tonight. My guest will be Dr. Jane Chrétien, an authority on tropical medicine. Wondering what you should do with your global travels? Find out next time on another edition of Housecall. Good evening.